the Fields Institute operates. For thousands of years, it's been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. And today, this meeting place, although virtually, is still the home to many Indigenous people from across Turtle Island, and we're grateful to have the opportunity to work on this land. And the speaker today, who I'm going to introduce, is Dr. Ali Asgary. He works at York University and has a different angle than your regular immunologist, virologist, mathematician, as in his focus is on disaster and emergency management. And he runs the ADERSIM facility at York, which is Advanced Disaster Emergency and Rapid Response Simulation. So you'll get to see his take on some of this stuff, which is unique and interesting. So I'll turn it over to you and take us away.
Thank you very much, Ben, and thank you all for joining us for this session. It's a great pleasure to talk to you about some of the work that we have been doing as part of the Mathematics for Public Health during the past 3 years or so, I believe. And yes, as Ben mentioned, it is from a different angle, which is mostly related to how all these emergencies, particularly public health emergencies and pandemics, are managed. Our focus on our part of the project was on how these things are brought together. When I say in these things, mostly what most of you are doing in terms of modeling, simulation, visualization, and mapping of disease spread, and public health issues. They're all brought and used somehow, some way, as part of emergency or pandemic response within a framework that is pretty much a standard, although it differs from place to place, but most of them, they follow a particular standard in terms of how they operate, how they respond to major public health emergencies. So as we started the Mathematics for Public Health project, I added or proposed another component to it, which was basically focusing on public health emergency operation centers. And through that, we conducted a number of research related to the use of various tools, particularly simulations, visualizations, modeling, and mapping in public health emergency operation centers. Because we thought this is important to know who are the end users of some of these models that we are using or developing, and how they use it, and what are the challenges that they face when, or if they want to use some of these tools and models that we or you basically develop. So that was part of the idea. And so, as you can see, EOC modeling was added to this project. And we are happy to basically report to you and others about some of the work that we have been doing in the past. And these are some of the people who have been working with me and with us during this past couple or 3 years in different roles, mostly as research assistant and postdocs and collaborators. Some of them still work, and some of them already on the job after they finish their research with us. The main goal, as I said before, for our part of the project or Mathematics for Public Health was to utilize our Advanced Disaster Emergency and Rapid Response Simulation facility at York University toward conducting research and developing some of the For example, public health emergency operations center-based exercises, simulations, and models. When we started the project, we were hoping that this facility would have been completed. Unfortunately, um, this didn't happen till very recently because as COVID started, unfortunately, the project, uh, I mean, the construction of our facility was halted because of the supply issues that we and construction, uh, stopped basically for a while. We couldn't finish it the way we wanted. So in a sense, we had to use other existing facilities to accommodate ourselves and our research. So we started some of the base research as we were waiting for the facility to be operational, which became operational basically toward last September. We used it for one of the activities that we organized and continue using it since then. So our key focus in part of that EOC related research and activity was in first to examine how the EOC or Emergency Operations Center at different public health um, agencies were activated. We were interested in knowing how they operated basically during COVID situations, and also how the decisions are made, how decisions are publicized, how decisions are communicated, etc. And in part, we were also interested in learning from these past situations or learning that happened during the COVID to develop what we call it future or next generation of pandemic exercises. These are exercises that are helping public health emergency operations centers people or people who are operating in this environment, how they to exercise running and managing a pandemic, considering that some of the issues that we learned during this COVID situation needs to be transferred into exercises that they can help next generations of public health emergency managers to be able to better prepare themselves for future pandemics. All of these operations are usually exercised, and for exercises to be effective, there needs to be based on realistic scenarios and also embed some of the key learnings that we want. We realized that during COVID, there were new challenges, new issues that we have not experienced in the past pandemics that need to be brought into future exercise. So our goal was also to develop some of these exercises in that sense. Now, I really like to give you some broad idea about what emergency operation centers or public health emergency operation centers in particular are before we jumping into the research or results of one of the research that we did on this particular um, system, basically. Uh, I don't know if I would like to know actually to ask people on the call to see if they know or they have experienced public health EOCs in the past or not. If you have, you can type in yes, or if you haven't, you can type no. But my assumption is that, being in the realm of modeling and academic, we may not have been exposed enough to public health emergency operations center. So I give you some brief information based on WHO's guiding principles for setting up what's called public health emergency operations centers. This guide is available online. The first version was published in 2015. I know that there is a revision coming up based on, again, things that they also learned during COVID situation. I'm looking forward to see the new version. Basically, discusses and introduces what an EOC is or has to be set up, etc. Now, on the right, you see some of the pictures from CDC's Center for Disease Control in U.S. Emergency Operations Center, which is quite a large facility, as you can see here. And but this doesn't have to be large. This could be as small as a room with maybe a tenth of all these systems or stations that you can see here. And so it could be could change from a small room dedicated to a public health emergency operations center to a large room or facility like this. But essentially, this is a physical location for coordination of information and resources to support emergency response and management. Usually it is at higher level, meaning that this is activated as emergency management facility where public health emergency is declared by the government or public health agency, wherever they are. And from there, those who are assigned to come and operate within this operation center basically show up and start following their rules and responsibilities and managing the pandemic or whatever health emergency it may be as this become activated. Now, there are a lot of examples. You can look at it. As I said, these are start from small to large and so forth. But the way these public health emergency operations centers work are sort of standardized. And when just by looking at these images and pictures, you can appreciate that there are lots of things going on within the public health emergency. There, you see the screens here. You see each stations that people are using. All of these are, of course, supported by data, supported by software, hardware, many different kinds of information and communication tools that are used to do this essential responsibility of coordination and communication and allocation of resources to the situation, whatever it may be. And so the current standards or approach that most of the public health emergency operations centers are following and or suggested by WHO in the document that I mentioned is basically this. An emergency operations center has these 5 key components of their system. On the top, you have the management section, and then you have an operations section and a planning section, logistics section, finance and administration sections. This is a very base framework of management framework. It's called incident management system. In some countries, in some places, they use what is called incident command system. A little bit different, but essentially, this is based on what WHO has recommended. Now, this is the base, but you can see that under each of these sections, there could be many different other boxes. For simplicity, we just stay with this one, but you can consider that each of these sections can have larger number of subsections, and even subsections could have still subsections. But this framework is good because it enables people to align themselves easily to each of these cells, depending on what they do, what is needed, and so forth. But for now, consider these are the main elements of the EOC. Public health EOC also follows the same component or structure. This is an example of what I was talking about from public health, the way it is managed at the Canadian level. This is from the government document. And as you can see, again, you have on the top, you have what we can call it the management part, although it is a bit more extended. And then all this stuff. This is the section that in previous slide here, I said management. Here it is, all these falls under the management section. And for example, you have emergency manager, then it is connected to what is called deputy emergency manager. So it goes into details of who are the players within the emergency management part. Then what they have, for example, a legal officer or section within the management part, and so forth. And this is the operation section where they actually divide or add some subsections into it. For example, under operation, you have vaccine section. You also have, for example, biological section. You have chemical sections. And under planning group, you have many different sections that, you know, each is specific to either a particular scientific community or group, or even people who lead the planning activities. Same with logistics and admin. So just want to highlight that, you know, this simple structure here can be expanded and become something like this. And this is also even simple, but you will see in some examples that each of these may also be expanded to some other subsection. But the essential and the principle here is that as needed, this scaled down or scaled up, depending on the level of emergency, depending on what kind of emergency we are dealing with, what resources are needed, what sections, what organizations are needed, etc. The most critical part is that for each agency being involved in the whole emergency response or public health emergency response, they know where they fit. So if their role is mostly related or their functionality is most related to operations, they join the operations section. If it is more of a logistic, they join the logistics section. This structure helps the different groups, different agencies, different departments to be aligned to each of these sections, depending on what they can offer, what resources they have, what expertise they can bring into the management system. Now, very briefly, these are some of the slides really based on the same document that explains, you know, some of the key operations or activities or roles under each section. For example, for the management part, as it is obvious, these are the key people on the top who basically oversee the overall operation of Emergency Operations Center. And they are the ones who are responsible for much of the coordination and liaison between different agencies, and of course, public communication. Usually the heads of, you know, the public health agency and people on the top are part of this cell or box. Then you have operation sections. That is, as name suggests, you have a large number of organizations, agencies, departments that are providing operational support to handling the emergency. For example, vaccination is an operation. So any agency, any department that has capacity to provide vaccination falls under the operation section. Or, for example, triage, or even testing in the case of COVID. And these actual activities, operations fall under the operation part. Then the planning section, it is more of scientific and predictions, modeling, etc. Within Public Health Emergency Operations Center, most of those activities fall under the planning section. And so this is the section that works with the data, collects data, analyzes the data, predicts, and so forth, and even develops plans, strategies for handling the emergency, and even identifying technical expertise that may be able to provide support to the whole system. So this is basically the the brain of the emergency management system, and much of the data analysis, modeling, simulation channels through these sections to the rest of the emergency operations center. Logistics section, as name suggests, also is responsible mostly for acquisition, tracking, storage, and staging, maintenance, and disposition of the tactical and operational resources. It is where resources are handled. Resources, whether it's human or equipment, etc., etc. This, as you can see, there is a list of the equipments and logistics that logistics section looks into. All the facilities, hospitals, for example, or mass vaccination facilities, services such as telecommunication, all you need, for example, to support communication between different sections are handled and supported by the logistics section. Everything to do with furniture, food services, etc. Name suggests basically. So this section is all responsible for everything related to the logistics to support the emergency or public health emergency operations, transportation, etc., etc. And then finally, you have the finance and administration section that has, again, responsibility for all financial and human resources related to managing the emergency at, in our case, public health emergencies. Anything to do with the budget, anything related to cash flow, tracking materials, human resources, cost, and so forth. So putting all these things together, you appreciate that, handling a public health emergency at the EOC level requires a lot of, departments to be involved. There is a complexity in managing the relationship between these departments and their involvements. So much of it is really about coordination and communication. And that's why most of people who work within this environment, they really talk about command, communication, and coordination of being the key elements of being able to manage this, large, especially a group of agencies, departments coming together to manage the system. And over time, obviously, over in all countries, we have realized that this is a system that can assist us with, or a framework that can assist us in being able to do all this coordination and communication in a dynamic, rapidly changing situation. Now, obviously, as we talked about before, you can see that there are, as even society progress toward use of technology and software, hardware over time, there has to be an information system in place where the data and communication between different agencies here are handled. So there is a standard or procedures or recommendations for how to set up information systems within the public health emergency operations centers in terms of resources needed, in terms of indicators that they are looking at, data sources, data management. So these are things that comes very much close to what we are interested in mostly when it comes to interface between public health emergency operations centers, modeling, simulation, visualizations, and mapping. Most public health EOCs and EOCs in general, they use a variety of software tools. There are some general purpose EOC software actually designed and even defined like public health emergency operations center software. You can buy them from off the shelf. There are some that are customized. There are some, of course, within public health because it is a specialized area. So there is a need for some specific public health emergency operations center software related to, for example, different types of diseases, different types of situation that they are facing, and so forth. Vaccination, for example, may have its own dedicated software tools, whether in terms of uh, managing the vaccination process or an allocation of resources related to vaccination. And then you have a lot related to surveillance and warning. Uh, you want to warn people, you want to also do surveillance of the disease spread, etc. There may be, and there are different software tools that are either used within the EOC or connected to EOC, as their output comes to the EOC, as we have seen during COVID ourselves. There were a number of surveillance softwares or applications that at the end of the day, they provided information to the EOCs. And there are, of course, software providing situational awareness, mostly like dashboard type of software tools that help people who are within the emergency operations center to get a sense of what is happening at any given time. So I really like to you to see this a short video that summarizes basically what I talked so far for the Public Health Emergency Operations Center based on CDC's EOC. Let's listen to this and watch this. This is a short 2 minutes video. Run. So that was a very short video explaining what a typical, I mean, it's a typical emergency operations center works, but covers basically what I was trying to tell you in those slides in action. So, as part of our activities related to Public Health Emergency Operations Center, our team, in part, for example, we organized jointly with our partners and Fields and ViEmerge and CFAL York a symposium in last September. We called it Inside Public Health Emergency Operations Centers, where we invited some of the public health leaders at federal, provincial, and local levels to basically talk about their experiences of running their emergency operations centers at different levels. To hear from them directly, which was quite interesting to really compare the situations at different levels, and it provided a lot of insight into the what we were trying to explore and examine. As part of our research, we also are involved in developing some new tools for pandemic management, including serious games. This is a game that is being developed by one of our PhD students now. We tested the prototypes and about to publish a paper on that. Hopefully, creating some teaching and educational tools for public health or pandemic emergency management based on, again, lessons we learned during COVID. We also developed an emergency exercise or tabletop exercise for emergency operations center setting to what we call it next generation pandemic exercise, basically to include some of the lessons learned from the COVID into an exercise that I was talking about. We started, as we developed the exercise, we started testing it at different levels with the students, with medical professionals, with medical students, public health students, our own emergency management students. And these are examples of one of the exercises that we ran, the same exercise we ran once with Ontario Medical Student Association leadership. Really liked it as a learning tool for them. We also did run the same exercise as part of our symposium. And one day, this is a mix of students, postdocs, and public health professionals attending the symposium. Again, just to test run the exercise that we developed, fix some of the issues or challenges that the exercise has, so that it becomes an exercise that can be run and used by all other agencies in the future. And now to the point I wanted to talk about most, that is a study that we just finished, the results in a paper. It's called A Survey of the Use of Modeling, Simulation, Visualization, and Mapping in Public Health Emergency Operations Centers, of course, in Canada during COVID-19 months. And as I said, one of our goals was in this research was to understand what kind of models, what kind of simulation tools or visualization were used in public health emergency operations centers. So our definitions of these tools are very common. I mean, I don't need to explain it to you. You are all within this, business or activity, anyways. But for others, when we started talking about what we mean by mathematical models or by simulations or visualization and mapping, we provided these brief descriptions of what we really mean and how we distinguish between them. Although it's really, as you can imagine, difficult to separate all these things from each other. Some tools that we have are mix of all of these. and some different. But for us, it was important to learn more about how and if they are used within the Emergency Operations Center and what are the key issues and challenges that they face. So we, I think it was during in 2022, early 2022, we started developing our survey instrument, which was a questionnaire that included about 30 questions. And our target responders were managers of public health emergency operations centers in Canada. And so after we finished designing and testing the survey with some of the public health units within Ontario, we publicized and sent the link of the survey. This was an online tool we developed survey in, and we shared the link to public health emergencies across the country. Starting in March 2022, we continued leaving this available because it was during COVID and not all these most public health emergency operation centers were active and actually busy with COVID situation. So we gave more time for them to fill the survey. At the end of the day, we really had about 13 responses from different provinces and territories, which is not ideal in terms of number of responses, considering that we were hoping to get more. But it was enough to say that we have received a good portion, or responses are a good portion of the total number of you can call it emergency operations centers in Canadian public health system. Overall, this looks to be a good portion of them, although the numbers were not enough or significantly high for us to conduct, particular statistical analysis on them. But the general results shows some of the patterns of use of these tools inside public health emergency operations centers. These are some of the basic data information about who the responders were from different provinces. Now, one key question that we asked was, what are the sources of the data used for modeling, simulation, visualization, and mapping analysis within public health EOCs? And this is what we got. Basically, for the most part, as you can imagine, majority of responders were saying that the data comes from government agencies or data collected or developed by public health, and at some levels also local medical facilities. There were some who responded getting their data from private organizations or not-profit organizations, but majority, of course, you can see they receive the data from their own public health or government in which they operate. One question, or another important question we asked during this survey was how much basically they use these tools, and specifically mathematical tools, simulation tools, and so forth. And, although we knew that there are, agencies, public health that use this vastly, but to our understanding, the samples that we had overall, you could see that most of them responded. Sometimes they are using these tools. Only a few said always they are using these tools, and majority, as you can see, for always it is very few. I mean, just two, but it is mostly visualization and mapping tools that are used, almost always. if you go, for example, mathematical models, you can see how within our response system, how they mentioned, um, you know, about 5 of them said, for example, that they sometimes use mathematical models within their EOC. I mean, this is important to note. We also ask question about what and why they use, what is the purpose of using this modeling, simulation, visualization, and mapping tools mostly. And again, as you can see, and this is interesting and also very much relevant to what I talked before in terms of functions of EOCs, Emergency Operation Centers. This is uh, what mostly they use it for, surveillance and situational awareness, which makes quite a lot of sense. And this is part of the planning sections of the EOC. They develop and use this mostly to inform the rest of the EOC about the situation. And again, you see mapping and visualization seems to be uh, used quite a lot, although this is subject to the same question and discussion that I had. Visualization and mapping are part or related pretty much, or are based on mathematical models, or could be based on simulation tools for the most part. So in a sense, although you can see visualization and mapping to be used mostly for surveillance and situational awareness, it doesn't mean that they are not really well connected to, or not connected at all to the other tools. For scenario analysis, they use these tools, and then forecasting, resource allocation, not much. And there were some other responses to our questions. We also ask question about which EOC sections are mostly using mathematical models, simulations, visualization, and so forth. And again, not unexpected result, considering that planning is the core of scientific and data management or analytical part of the system. They are mostly those sections that use these tools quite more than others. But you see that other sections of the public health EOCs also use quite a lot, particularly visualization and mathematical model tools for their purpose, or for their section. And then you have logistics that these are responses by different public health agencies to our question. Seems to be using different tools, especially mapping tools, for their purpose, and to some extent mathematical models. And I guess this is more of those who use mathematical models to predict and understand how much of different equipment, facilities they need to add to the EOCs. And then we ask another question about the type of analysis they use MSVM for. And here we had a large list, and as you can, for example, see here, about 12 of the respondents, they said they use these tools for counting deaths, number of deaths, or case count, for example, or here you see vaccine coverage rates and or hospitalization. This was a large list, and then we basically asked them, if you use these tools, what are the areas that you use mostly these tools for? And these are the results basically provided by our respondents. And you can see almost all respondents except one said that they are using these tools for these 4 or 5 items here. We also asked one question about the intensity of using these tools by different EOCs. By intensity, we meant really how did this started at the beginning and continued over time during the pandemic. And this is the results basically showing, for example, that use of mathematical models, 6, as you can see here, they said it was a steady over time, so no change. We started with some mathematical models, continued over time is the same. And or here you see that there some agencies that said their use of these MSVM tools increased over the course of pandemic, or there's not the others doesn't show significant, but this is the mostly the steady and the increase that are highly different basically in this. But it gives us an indication of whether public health EOCs started, expanding the use or shrinking the use. Overall, it seems that there were, in some cases, an increase and in some cases, steady use of these tools over time. And this is my final results of the survey, giving or providing to you here, which was really what we wanted to focus most on, which was some of the gaps and barriers in use of MSVM tools by public health EOCs. Basically, we wanted to learn from them if they are using these tools, what are the gaps? And if they're not using, what are the issues that they face? These are some of the highlights of the gaps that we, based on our initial study, we listed in our study. And these are the responses based on, the responses that we got from the respondents. Giving you an example here, you see turnaround and production gaps, meaning that we asked them if creating and producing these tools was an issue for them, and for significant number, as you can see, they disagreed with that, meaning that they were able to create these tools, so they didn't have any issue with that. Or we put in an issue or gap related to common language and terminology. This means what a terminology used in these tools, were they understandable by people who were at the public health EOCs? As you can see, again here, there doesn't seem to be a major issue here, meaning that, a good number of people disagree that there was an issue for them here. I have to check this myself to make sure that I'm interpreting the results correctly here. To give you hardware gaps, for example, we asked if there were any hardware gaps in use. You can see how many, for example, 4 public health agencies mentioned that, moderately disagree. If you ask them, did you face any hardware issues? This is the number that said, basically disagreed with that or moderately disagree. Seems that they didn't have or experience hardware issues. Or here you have, for example, those who agreed with this data privacy and security gaps. A good number, like 5 of the total number of EOCs mentioned that they had some of these issues with the MSVM tools that they were using. They couldn't use, or they were cautious about using them because of the privacy and security gaps. And here, when I finish with this one as an example, data availability issues for using these MSVM tools. Here you see a strongly agree that many agencies, or significant number within the sample size that we had, 5 here, said they had issues related to availability of data when it comes to use of these MSVM tools. So our goal really was to provide some insight into, especially for those who develop, create these models, to understand better how these models, how these tools are used within the public health EOCs, and what are the key issues that they face, so that when in the future we want to develop, expand our models, we want to create mapping visualization tools, we know the directions that we want to take to make them better and more efficient, basically. And this slide summarizes some of our key findings. I mean, I talked about most of them, but essentially what we got to know was that there were some serious challenges and gaps, particularly related to data privacy and security issues, as I talked about, and some of the gaps related to interoperability and technical capacity of EOCs in using some of the tools developed, meaning that there is a gap between the technical capacity of the personnel within the EOC versus what is provided to them. There always needs to all these tools need to be supported by additional, technical capacities, especially in situations where you do not have that, technical personnel, make it difficult for them to use these tools. So this was a summary of our study on this particular case, and I would like to acknowledge our, of course, support that we received from a large number of teams and agencies and group, particularly Ontario Research Fund for funding ADRCIM, and CERC for and Public Health Agency of Canada for supporting the whole project, Mass for Public Health Network, and also CFI Guelph, that was part of the lab that we are using some of the equipment for this research. And I think that was it. Sorry, I went a little bit beyond my scheduled time, but I'm ready and happy to hear any question you may have. And the